And now, while we're talking about structure, most tend to think of it strictly as the physical body. But I do feel it important to point out that holistic systems are going to include much more than the physical tissues of the body. But as the great Ida Rolf had said, understanding or favoring an understanding of the body as a complex biological event. That structure is both medium and a result of function. And so what we're talking about is not only the alignment of collagen and water content, but also the integration of those free nerve endings and receptor sites in this connective tissue, and how an Ayurvedic Rasayanas or remedies can help support the regeneration of this tissue that is drowning in modern culture. I teach a lot of myofascial release to my clients. It is a slow process, but a very effective one, where slow holds and releases are accomplished, retraining that connective tissue. Oftentimes, the manual therapist will use their hands to create that tension, to create that decompressive force. Other times, and most times, we'll use some apparatuses like cupping or kinesio tape. These are tools that modern body workers are using to mimic some of these forces on connective tissue and help aid rasa dhatu in that exchange of nourishment and waste. Skin rolling is another technique that manual therapists will use to literally pick up the superficial layers of tissue away from neighboring structures and apply a rolling technique to diagnose where there may be adhesions and fibrotic changes in the tissue, and also as the intervention, as the Rasayana, to stretch and break some of those collagen fibers and produce the type of forces that will cue to the body to produce more support for that area. Now, on the opposite end of the spectrum is compression, which more and more people are asking for in their massage sessions. There doesn't seem to be enough pressure for people to feel ease in their bodies again. And this is where modalities like Ashiatsu massage might be integrated. You'll see that in the photo here on the slide here to the left, where the therapist is using their feet and body weight to apply the compressive force to the tissues. This is what is becoming more and more necessary for manual interventions to meet this need of the tissues to be hydrated and twisted and shaped in three-dimensional ways to create the cues for regeneration. I've even used my body weight to create a pumping mechanism along with the client's body part to use suction and vacuums that occur within a joint. For example, the photo on the left here, you see me using a lunge position and applying that compressive force on my client's femur bone. And what I'm doing in this photo is creating a compressive force so that the femur bone sinks deeply into this acetabulum, into the socket of the hip joint, allowing the neighboring hip muscles to relax. And then when I lift off my body weight, that bone is going to come back out and create this suction and this pump, if you will, with repetitive compressions from me and working in rhythm with my client. I'm able to create this pumping and this rocking and this rhythm to the technique. And I'll use this both with my feet and my hands. So in an Abhyanga, the classic Ayurvedic massage, there's a rhythm to the strokes. And depending on the health of this fascia, I'll modify both the rhythm and the tempo of the stroke in order to create this rocking and this unison between myself and the person on my table. These are really common approaches, and what I'm finding is that there's more and more need for this type of manipulation of the tissues to keep up with the demand. Other Rasayanas are going to, of course, include nutrition and lifestyle, having a vata balancing diet, and adhering to food combinations that are going to be gentle and easy on the gut to digest. Collagen is the fastest growing supplement in the US. A study back in 2018 showed $45 million industry for collagen supplement alone. So people are wanting to extend their longevity and avoid these major invasive surgeries. And how we're able to do that is in part how we're able to nourish ourselves through our food and through these bodywork therapies, abhyangas, shirodharas, bastis, and a lot of classic snehana treatments that will bring that hydration to the tissues along with the communication to the nervous system. We're also finding in research now with fascia that when collagen is taken in conjunction with vitamin C, it ups the ante, that there's a deeper absorption, and that you will, studies have shown the workload or the ability for a tendon to handle compressive or tension forces increases by as much as 50% when collagen is combined with vitamin C. Also, glycine is in some early studies with mice showing that it improves collagen production and production of those glucosaminoglycans, those GAGs, giving tendons a greater mechanical strength. Now, the studies are preliminary, and they're showing about 25 grams a day of glycine would be necessary to produce this effect on the tissues, which would not be very practical in our modern times. You'd have to basically take a bottle of a supplement of glycine to reach that dose. But the studies are encouraging, and they would warrant some further study in humans. With our training and our choice around how to bring that stimulation to cells, that will vary depending on your stage of life, depending on your health history. But what we do know is that the highest function of our muscle tissue is to be able to balance workload with rest. That longevity mode is very different from growth mode. There are two opposite ends of the spectrum. And what we're learning is that short loads combined with long rest periods are the most advantageous for regenerating tissue and keeping the athlete or the mobile adult mobile and being able to maximize the cellular response of that workload. Wolff's Law states that bone tissue is initiated into growth based on the forces that it's subjected to, which is why when you heal from a fracture, at some point, your doctor is going to have you start weight bearing. And that's to trigger the cue to fascia, to bone tissue, all starting with rasadhatu, to build that stable tissue and create more stability for you. Now, I think in terms of an Ayurvedic perspective, what I'm finding is a mixture of using plant medicines, using herbal tylomes and warm poultices that are dosha specific, and combining that with marma chikitsa, with the stimulation of these energy points on the body. And earlier I talked about those fascial trains those lines in the body of these fascial bands, if you will. And that's what you see here in blue. Now, there are many more fascial trains than the ones I'm showing you here. Here are just some of them more intermediate and deep fascial lines in the body. And on top of that, I've superimposed some key marma points that are supportive of rasa dhatu and mamsa dhatu especially. So as I work with clients on the table, performing myofascial releases, or teaching them how to perform it on themselves with a ball or a foam roller, I'm also stimulating and paying close attention to these particular marma points. I think that when we're stacking these techniques is when we're going to get the best result, because managing expectations of clients is becoming more challenging. People want luxury and comfort, last minute availability, complete, instant, total body relief in one session. And so there's a great deal of education to be done around the factors impacting our connective tissue and prioritizing our rest, our sleep, and our digestion, and teaching people how to move their bodies, teaching them how to incorporate more pulsing, twisting, shaking, jostling, and unique primal movements into our daily lives to feed and wring and squeeze that sponge that is fascia. And then for the pros, be able to incorporate variations to your strokes, to your techniques. I use a lot of pin and pulls or pin and mobilize techniques that I teach in my continuing ed trainings, where addressing those deeper layers of fascia are necessary in order to open up those channels for flow. Because once those channels are established, now we have the flow of prana, and blood supply has been restored to the musculoskeletal system, and we're better able to manage those vibrational frequencies and the rise of kundalini, because now the vayus, the nadis, the chakras have all been addressed with the fascia being balanced, being hydrated, being stimulated to produce the right kinds of cellular regeneration. Nowadays, we're getting more and more into artificial intelligence with wearable devices. Here in Colorado Springs, we have the U.S. Olympic Training Center and world-class elite athletes coming here to train with our altitude. And so these athletes are using a lot of artificial intelligence. Their coaches and trainers are creating digital twins of athletes to better predict the load or strain of an injured tissue before returning back to a competitive level. We have injectionable gels. I mentioned earlier, interspecies transplants. It's a really exciting world out there for tissue regeneration and rejuvenation. And it's complex and requires a bit more candor, especially here in the West with regard to our agriculture and lifestyle methods. That any intervention or Rasayana will be limited if our clients cannot understand the context and the terrain that they are really working in. And so stacking marma points with diet and lifestyle, with knowledge around how fascia repairs itself and what kinds of stimuli it needs in order to do its job really well, this is where we can begin. I'll pause there for some questions.